Oral minoxidil in dermatology, this is a disclaimer for general public, please read it. And for those who are derma residents, myself Dr. Maddineni Srinivas, your dermatology faculty from Bharat. So these are the references. After completing watching this video, please do go to these references and read the topic oral minoxidil in dermatology. Very important from exam perspective. It was asked as a 5 marks question and you need to know what are all the headings which you can mention related to this topic. So you can write down the introduction which we will discuss, mechanism of action, pharmacokinetics, what are the indications, what does this low dose exactly mean, and what are the adverse effects, and also safety monitoring of this medication. So coming to the introduction, the minoxidil is a piperidinopyrimidine derivative which was initially historically used for acid peptic disease and also for treating the severe hypertension because of its vasodilatory effects. But in the patients who are having hypertension and who were started on the minoxidil, it was observed that there was a side effect which was a very good effect which we dermatologists want, that is excessive hair growth, which is called as hypertrichosis. So this is called as serendipitous side effect, that is we are using the molecule for one indication and we have observed the side effect which is actually an indication in other condition, right? And so from then onwards the minoxidil topical formulation has become the US FDA approved for the hair loss or hair disorders. And nowadays the low dose oral minoxidil is being used, and you must remember that for the hypertension the dosages which were used for 10 to 40 milligrams, but in the case of the dermatological indications the dosage is going to be way below this. Maximum we are going to use up to a dosage of 5 milligrams, so and even below that. So that's why it is called as low dose oral minoxidil, and especially this is useful to improve the compliance of the patients of especially androgenetic alopecia who are using topical minoxidil, because there are so many issues with topical minoxidil, because there could be this propylene glycol or which could cause this contact dermatitis, irritant or allergic, and also there could be suboptimal response to the topical therapies. All these can be taken care with the help of this low dose oral minoxidil. And you should also be knowing the 5 C's associated with low dose oral minoxidil. So what are those? It is very convenient for the patient to use this oral formulation, so because there is no jhanjat and there is no headache of messiness of application of the topical formulation of minoxidil. And also cosmosis wise also it is very favorable, that is it avoids greasy sticky hair texture, because of which hair styling may be little bit difficult with topical formulation. It's also comfortable because it's only to be taken orally, and it also elevates any other causes for the allergic contact sensitivity, which may lead to unnecessary second follow-up after starting the topical formulation of minoxidil. It is also cost effective, it is highly affordable and inexpensive even for long term prescription. And as I have already told you, it is very compliant. It is very much proven that patients do not want to apply the topical formulation twice daily. Instead, they can just take this medication orally in the night time before bedtime, right? So it has significantly higher long term compliance. So what are the pharmacokinetics of the oral minoxidil? So you must know these. There are few important points. Though in dermatology we use oral minoxidil in young population, but because this minoxidil has some complications which are very important to be known, and those can be easily avoided if you know the pharmacokinetics properly, thoroughly. So what are all those things which you must know? That is systemic bioavailability. See, this oral minoxidil, it has almost 90 to 95% of the bioavailability when it is taken orally, because it's going to be absorbed through the GI system in a beautiful fashion, and the bioavailability is only 1.5% with topical formulations, right? So it is extremely small doses which you are going to use, 0.25 mg, 0.5 mg. In that it is going to achieve the therapeutic follicular tissue levels that equal or exceed the twice daily topical application, right? So this is one very interesting finding. The bioavailability is very high for this molecule. Half life of oral minoxidil is 3 to 4 hours, but you should remember that there is one very interesting finding, that there is going to be intracellular accumulation of the active metabolite, that is minoxidil sulfate, in the hair follicle, which will persist for much longer duration. So that's why even OD dose at the night time is going to be enough, even the serum half life is only 3 to 4 hours. It is metabolized 88% in the liver. So it should be remembered that extreme caution should be maintained in the patients who are having a hepatic impairment. That is the reason why you can do the normal investigations like CBP, LFT, KFT before initiating the oral minoxidil. Even the renal function is also important, because 12% is going to be excreted unchanged from the urine, right? So you should also be looking for any renal failure is there, and if there is severe renal failure, then it's going to lead to the fluid retention risk, which is also seen in the case of minoxidil, and it will be added upon if there is additional severe renal failure. Dose dependent mathematical scalability. So what is this point? So if there is a increase in the dosage of minoxidil, oral minoxidil with 1 milligram, it was observed that the hair density and also the hair diameter are increasing proportionately. So we are going to have a maximum effect with up to 5 milligrams without producing any other adverse effects with the oral minoxidil. What is the mechanism of action? What is this magic molecule actually producing in the hair follicle? This also you should be knowing. So oral minoxidil is a prodrug, and I have already told you that the active form is minoxidil sulfate. So the biological effects are all related to the effects near the hair follicle. So what are all those things? First of all, there is going to be activation, that is formation of minoxidil sulfate at the follicular level. So this is minoxidil sulfate formation due to the sulfotransferase enzyme, which is especially localized in the outer root sheath and also in the dermal papillae of the anagen hair follicles. So all these are very important points to remember, and thus this minoxidil sulfate is going to prolong the anagen growth phase, and that is the reason why the length of the hair, which is dependent on anagen phase, is going to increase in the patients who are using this minoxidil. And also it will shorten the telogen, that is a resting phase of the hair, and also it will increase the hair follicle diameter, that is we can in a way say that it will convert the vellus like hairs into the terminal, very thick terminal hairs. Next one, very important one, the activity on the vascular and the angiogenic stimulation. And how is this going to achieve this? Because it is a potassium channel opener, there is going to be this vasodilatation, which will increase the blood circulation to the hair follicle. Also it will increase the vascular endothelial growth factor, hepatocyte growth factor, insulin growth factor levels into the hair follicles. So through all these, it is going to enhance the growth of the hair follicle. Okay. Also remember, it is having a modulatory effects in the prostaglandin, whereby it is going to stimulate the prostaglandin synthase, whereby there is going to be increase in the prostaglandin E2 levels in the dermal papillae, thereby promoting the cell survival, especially in the anagen hair follicles, and it will also inhibit the apoptotic pathways. Also remember, apart from the hair growth in normal persons, if the individual are having some kind of autoimmunity, minoxidil also has an immunomodulatory action because of its effects of suppressing the T lymphocytes, and thereby this underpins its efficacy in treating the immune mediated hair loss disorders, especially the alopecia areata, right? And not only this, I will also show you that even in the cases of the scarring alopecia also minoxidil has a role. How is it going to have a role? I will tell you. But before this, just to summarize whatever we have seen, oral minoxidil injection. So this flowchart you can write down in your theory question. It is going to be absorbed rapidly through the J system because it's having a very good bioavailability, 90%. It will enter the follicular outer root sheath, and thereby it is going to get activated through the process of sulfation. So this minoxidil sulfate, it's going to act on the ATP sensitive potassium channels, thereby it's going to cause this vasodilatation, causing the increase in the local microvascular blood flow, and also it will act as a key biological pathways, that is it's going to increase the VEGF, PDGF, and also it will stimulate the prostaglandin synthase 1, PGE2 levels will be elevated. and also it has immunomodulatory actions. Ultimately what it causes, prolongs the anagen phase, enlarges the miniaturized hair follicle. So these are the two most important things which are going to happen after the usage of the minoxidil, right? So apart from this, I have told you one more important point to remember. So this is that point which you have to know, that it is going to inhibit the collagen synthesis, and also it is having anti-fibrotic properties. Thereby minoxidil can also be used in the patients of scarring alopecia, especially the lichen planopilaris, pseudopelade of Brock. Okay, but it is going to be used not as a monotherapy but as a add-on therapy along with the anti-malarials, which we will use in those cases. Now let us look at what are the indications of the minoxidil, especially low dose oral minoxidil. So I have already given you a hint what is low dose oral minoxidil. So in the hypertension, the dosage is 10 to 40 mg, but in the dermatology, the usage is for hair loss, the dosage is going to be very low. It is, that's called as low dose oral minoxidil. And with the use of this low dose, we are only going to isolate the hypertrichotic effects of the minoxidil. And remember, the oral minoxidil in all formulations, in all dosages, it is a completely off-label indication. There are no any USFDA approved indications in dermatology for the minoxidil for the hair loss. Very important point to remember. So let us quickly see what are all the indications. So in the androgenetic alopecia, remember it is going to be used from 18 to 40 years of age group, because in the children safety profile is not completely known, and in the elderly it is associated with problems, especially in those who are having already cardiovascular symptomatology and some kind of disease. So that's why this is a safe age group, 18 to 40, and the dosages could be 2.5 to 5 milligrams as a OD, and it can be combined with the finasteride, dutasteride, which are going to inhibit the conversion of the testosterone into dihydrotestosterone. Thereby we can have the synergistic effects, that is minoxidil is going to act upon the vascular arm, and the finasteride is going to act on the androgenic arm. So both of them we can make use in the males, okay, because finasteride cannot be used in the females. So in the female pattern hair loss, we can use females with diffuse central thinning, 0.25 to 1.25 mg OD. So if you observe carefully, the dosage is very low in the females, and yeah, there could be this higher risk of localized facial hypertrichosis. But if the hair growth over the scalp is going to happen, then usually we can make some kind of arrangement. We can advise the female patients to use some kind of laser hair removal, whatever we can get rid of the vellus hair becoming terminal over the face. But regrowth of the hair over the scalp is very crucial in these patients. Chronic telogen effluvium, you know that it is a reversible condition, but still if the hair loss is very prominent, then we can use 0.25 to 1 milligram as a OD dose, and it will stabilize the hair cycle, and it will reduce the daily club hair shedding, that is telogen hair shedding, and it will provide reassurance to the highly anxious patients. So this is what the usage in the chronic telogen effluvium. And in the alopecia areata, those patients who are having this patchy or extensive alopecia areata, alopecia totalis, alopecia universalis, it is an off-label indication, as I have already told you. Dosage, it could be 2.5 to 5 milligrams once daily, and it should never be used as a definitive monotherapy. This is a point to remember. We should always give it as an adjuvant therapy. It could be the other medications could be steroid pulse, or it could be JAK inhibitors, but remember it's never used as a monotherapy. Next, like I have already told you, because it can inhibit the collagen synthesis, and also it is anti-fibrotic properties, this can also have a usage indication in the scarring alopecia, that is lichen planopilaris, frontal fibrosing alopecia, and pseudopelade of Brock. So the dosage is going to be 1.25 to 2.5. Thereby it is going to basically stabilize the follicles which are having this inflammation, and also it is going to cause increase in hair diameter and also hair density in the normal uninvolved hairs. Thereby it is also going to act as a camouflage to cover the already hair loss areas, that is scarred hair loss areas over the scalp. And coming to the usage of the topical minoxidil and oral minoxidil, there is a concept which you need to remember, that if you are having a patient who is already on topical minoxidil and you want to start that patient on oral minoxidil, then what is the practice which you have to do? Simple, that there should be a transition scheme which you should follow, which is called as dovetailing transition protocol. So in this, what we are going to do, for 3 months we are going to ask the patient to continue the topical minoxidil, and we are going to add this low dose oral minoxidil. So for the 3 months, patient will be on both low dose oral minoxidil as well as topical formulation. Then at the end of the 3rd month, we are going to ask the patient to discontinue the topical minoxidil, and the patient will only be using oral minoxidil. So this is how we can slowly taper, or we can stop the topical minoxidil. We should not stop this abruptly, because this could lead to the sudden shedding of the telogen hairs. So this is one problem which we should counsel the patient to, and also we should also take care that the patient will not stop the topical minoxidil suddenly, as I have told you, because it could lead to the severe telogen shedding flare. And while using this in combination, there could be a high likelihood of possibility of facial hypertrichosis. We should also explain this to the patients. So next, coming to the adverse effects. So these are also important. So remember, at high doses of 10 to 40 mg, most of these adverse effects are seen, but also at low doses, some of the adverse effects are seen. Most common one is obviously the hypertrichosis, but apart from this, you should be knowing the other important adverse effects which we are going to cover. So in the cutaneous, hypertrichosis is the most common adverse effect, and the systemic conversion of the vellus hairs into the terminal hairs is going to be seen, especially over the face. So that's why counseling is mandatory. This I have already told you. And this conversion of the vellus hairs to terminal hairs, it is going to completely reverse if the medication is stopped for after 4 months, right? Now there is going to be this paradoxical shedding during the first 2 to 8 weeks over the temporal area. So this is also important to counsel. So pre-treatment counseling is mandatory for this also. And why is this going to happen? Because of the immediate telogen hair follicles which are going to be released, and there is going to be conversion of the telogen follicles into anagen follicles, because obviously we are using minoxidil to get the hair growth, that is growth of the anagen phase. And because of the initiation of the usage of this, the telogen phase is going to be arrested, and the anagen phase is going to start in the particular hair follicle, leading to sudden appearance of the telogen shedding, which a patient may feel that I have applied this, because of which I am having this hair fall. But this is absolutely normal within the first 2 to 8 weeks. So we should counsel the patient about this very important finding. Just like in isotretinoin, we can have the acne flare initially because of the initiation of the action of the isotretinoin. So likewise, this is also having this. Not only that, we should also tell the patient that this is a positive prognostic sign, indicating that actually the medication is working in the patient. Just like the isotretinoin, if it produces the dryness of the lips, we can say that it is actually working in the patient, right? Next is related to cardiovascular. So minoxidil can produce reflex tachycardia, increase in the heart rate, palpitations, and also it can cause postural hypotension, dizziness. But in dermatological dosages, that is less than 5 milligrams, this is very rare to be observed, but still a possibility is there. That's why you advise the patient to take this medication strictly at the bedtime. Also, like I've already told you, there could be a fluid retention and the pedal edema. All this is because of the sodium and water retention. So when we are initiating the treatment with minoxidil, we as a baseline we have to check the heart rate, blood pressure, and also weight should also be monitored and jotted down, because there could also be sudden weight gain. And if it is a severe case, then the low dose loop diuretic spironolactone can be added in such cases. Okay, and so idiosyncratic effects because of minoxidil. So these are extremely rare, they are not at all common. The patients may develop pericardial effusion and tamponade. So that's why like we have already discussed, the age groups in which this is used commonly is 18 to 41 years, and we try to avoid this in the elderly, because there is high likelihood of heart failure, coronary artery disease, or unstable angina in those individuals. And also remember, if you start this minoxidil and if the patient is having chest pain or dyspnea, this medication should be stopped immediately. It should not be continued. Okay. And what are the contraindications which you must be definitely aware of? Pregnancy, it's a category C medication. So we should not use this because it may cross the placenta and may produce the generalized hypertrichosis in the fetus, in the newborn. It could also cause cardiac strain in the neonate, and also it could cause severe fatal developmental anomalies. So that is the reason why in pregnancy this is absolutely contraindicated. In lactation also it is excreted in the breast milk, so it is not recommended. And like I have already told you, if the patient is having pre-existing cardiovascular pathology, then also it is absolutely contraindicated. Pheochromocytoma, this patients can there can be a stimulation and there could be a dangerous surge in the catecholamines, which could be due to the vasodilatory reflex due to the minoxidil. There are some relative contraindications. So safety data is not available, so it is not advisable to use in less than 18 years of age group. And don't use it with oral NSAIDs, because NSAIDs are going to antagonize the vasodilatory effects produced by the minoxidil, and also they can additionally cause fluid retention, which already the minoxidil is producing. So to summarize, remember the dose which is different in the case of the normal antihypertensive 10 to 40 mg, here it is going to 0.25 to 5 mg. That is very important dose which you must remember, low dose oral minoxidil. And as a part of the safety monitoring, you should remember baseline blood pressure, heart rate and weight should be recorded. And because we have already seen LFT, KFT can also help identify if the patient is having any abnormality in the functions of the liver and kidneys. And if you remember, the switching protocol also should be followed, so that there will not be any issues while tapering and stopping the topical formulation and putting the patient on complete oral minoxidil. So that's it in this video, dear students. I hope this was helpful. If so, please hit the like button and also do hype this video. And if you are not yet subscribed to my channel, please do subscribe. And if you have any doubts, you can ask the doubts in the comment section. We'll meet again in the next video soon. Thank you so much. Bye bye.